Hi, my name is Brittany Duncan. I'm here with my colleagues Azun, Ryan, and Mark, and we will be talking about achieving work-life balance. There can be many different causes of why it's hard to achieve work-life balance, but I am going to specifically focus on how balancing interpersonal relationships, disproportional compensation, and trying to maintain an overwhelming workload can be detrimental to healthcare managers and staff. Balancing interpersonal relationships can place a burden on a person's state of mental health. When you're unable to provide or be present in your personal affairs, you underperform in your professional environment. Receiving disproportional compensation is also a great cause of lack of achieving work-life balance. It has been reported in healthcare that one of three persons receive an increase in expenses without receiving an increase in pay. Lastly, trying to maintain an overwhelming workload can go hand in hand with the pay for performance, a case culture communication study that we recently seen in our recent reports. If you're underpaid, you have a lack of, you tend to perform, um, have a low performance rate. Being overworked and maintaining an overwhelming workload also contributes to these causes. Being overworked increases stress levels personally and burnout levels professionally in healthcare. Now I will hand it off to my colleague Azum as he can further elaborate on these causes.
So one of the potential causes for healthcare employee uh, burnout or imbalance in their work and life could actually stem from hospital administration, management, or clinical administration or management, particularly upper management itself. As seen in the chart provided, one of the leading causes of obstacles in work-life balance stems from management that does not support a healthy work environment. At times, bosses, as shown here, may be overbearing, demanding, or mean, as is shown as one of the big obstacles in not having good work-life balance. And sometimes these managers may also not recognize the amount of hours that their employees are putting in, and they may have inconsistent or inflexible work hours for employees, and that can make things extremely difficult in trying to balance out a healthy work-life balance. I'm now going to pass on to Ryan, who's going to speak about solutions.
Thank you, Azam. I'll be talking about the solutions to the problems my colleagues Brittany and Azam just mentioned. Before I do, many of you healthcare directors and managers might be wondering how this would affect you or your job. 76.9%. That is the statistic I came across when conducting a study about the burnout epidemic in the state of Kuwait. With that, we found that 76.9% of surgeons were burnt out, leading to more medical errors, decreased quality of patient care, and patient safety. So what do I propose we do? As leaders in healthcare, what good are our medical centers if they can't help the people we've employed? We need to mitigate the problems first by controlling working hours. And this can be done in a few ways. Restricting the number of hours employees work, encouraging vacation time, empowering employees to take more breaks, removing the stigma associated with taking sick days, and addressing the volatility in scheduling, in addition to ensuring adequate staffing. To aid my statement, look at the graph below, which clearly shows healthcare workers each in a different color, and the results show how burnt out they are in relation to long working hours, affecting many nurses, followed by physicians and admins. Secondly, we should also consider increasing benefits And this can be done by increasing hourly wages, creating wage boards, providing adequate overtime pay and paid leave, and offering opportunities for personal and career development, all of which will build a sense of belonging and loyalty to the institution. Lastly, promoting well-being. And this can be done by providing access to mental health support, extending paternal and maternal leave, establishing childcare centers in the workplace, enabling exercise and meditation, and providing access to bonding opportunities through events and activities. When implemented correctly, the positive effects of work-life balance can positively affect hospital financial performance, reduce employee turnover intentions, and decrease errors that could harm patients and staff, as you can see in the diagram below. It is our responsibility to ensure we provide the utmost care to our patients and our staff. I invite you to listen to my colleagues who will now discuss the steps to implement these solutions properly.
To expand on what Ryan just mentioned, particularly in promoting well-being and mental health, often mental health support for staff is overlooked. Implementing confidential mental health services can be incredibly beneficial. Access to professional trainings such as cognitive behavioral therapy and stress-reducing activities such as mindfulness and group activities can help aid work-life balance. Researchers have demonstrated that mindfulness interventions can effectively reduce stress, anxiety, and depression in both clinical and non-clinical populations. In a meta-analysis of 7 studies conducted with healthy participants from the general public, the reviewers reported a significant reduction in stress when the treatment and control groups were compared. Overall, reducing barriers to practicing a healthy lifestyle can mitigate some of the issues related to an unwanted work-life balance. I'll now pass over to Mark.
Thank you, Azan. The solutions my colleague just provided are critical in shaping work-life balance. It is advantageous that actions are set in place to help foster these solutions. Take an example, time. We should set a target number of work hours and stick to it. Set boundaries for yourself and your colleagues to avoid burnout. When you leave the office, avoid thinking about upcoming projects or answering any company emails. Considering having a separate computer or phone for work so that you can shut it off when you check out. If that isn't possible, use separate browsers, emails, or filters for your work and personal platforms. Employee benefits. Establishing a more comprehensive employee benefit program that aids in fostering health work-life options. Managing employee benefits is an important and costly endeavor for employers. Organizations should analyze the existing workforce demographics to assist in determining the needs of various categories of employees. Younger employees, for example, may value time off more, whereas older employees may place a higher emphasis on retirement income plans. Nevertheless, creating better outlets for employees benefits both the employee and employer moving forward. And lastly, health. Establishing a health promotion program can be advantageous to all employees. As showcased in the diagram, creating health promotions through these 6 outlets can drive an employee to become more productive and better relaxed at work. Your overall physical, emotional, and mental health should be your main priority. If you struggle with anxiety or depression and think therapy would benefit you, fit those sessions into your schedule. Even if you must leave work early or ditch your evening spin class. If you are battling a chronic illness, don't be afraid to call in sick on rough days. Overworking yourself prevents you from getting better, possibly causing you to take more days off in the future. So please, I encourage you, take the proper actions towards bettering your health. This concludes our presentation, and thank you for your time.